Namaste. Welcome to my short video. Today I'm just going to show you some very simple trick when you are having really bad back or recently had surgery or something on your back and having trouble to sit and always the pain. Because I teach the seniors and veteran, I have seen a lots of pain like that, and sometimes we do so much strain ourselves, or sometimes maybe not taking care of body that happen. So very few trick here we can do easily at home, but sometimes you may not be able to sit on the floor, but you can always do on the bed too. But the bed has to be like a little bit firm, not the soft. Okay, so first what we do is we go all the way on the wall, okay, and then put the pillow on your back, very soft pillow, so that way you are not rounding your back forward. So when you do that, you gently press your shoulder back and you flex your toes. When you're doing that, flexing your toes, and then you feel that nice stretch coming to your lower back. Sometimes you feel that, sometimes may not feel. So you can just keep moving. So ankle and your hand, and just do very gentle movement. You can do your hand, you can do elbow, moving that slowly. Just sitting there and just doing that for a little bit to warm up. Either way your leg goes out or in. Just do very gentle internal external rotation. Okay. After then you can push the elbow back and slowly try to do the cactus. Usually when you do the cactus, your hand doesn't touch the wall. Sometimes we open like this, and in that case you open your arm a little bit wide, or just do one. Okay, when you're doing the one drop, that may be more relaxed and pushing. So pec muscle right here is stretched and shoulder is stretched. So much shoulder is stretched, and then you're contracting here. So when you're doing that, push, and we're going to stretch right here. And then slowly drop down that side. We're going to go other side. Just do it again same way. So press that as much as you can. You feel that nice stretch here. And then once you do like several times, both sides, and then you may feel a little bit open up. But if your back is hurting, please don't push. So when you're doing that, you may be arching your back, but try to push your belly button towards the wall as much as you can, okay? Engaging your abdomen, and you can stay there. Or open your arm and look to the side. Gentle, very gentle, looking to the side. So stay there a little bit, and then if your back hurts, you don't have to drop and relax or bend your knee. Just sit there a little bit. So when you're sitting like this, sometimes you're pressing your back, just feels so good. So back is straight, bending the knee. That's always helpful. And once you bend your knee, open your leg a little bit and just do gentle going side to side. But don't go too far. Okay, lie down, we can do farther. But sitting here is not that much movable on your hip. And just do very gentle right here. And then from there, we're gonna go and lie down. Okay? So when you're going to lie down, you go and slowly, and always make sure you don't lie down like this, your back is hurting. So usually people do like that, but please drop your knee one side, both knees. And then drop your side body slowly. And that pillow, I don't need it. So you can do small blanket or towel under your head and just slowly lie down, and then come back slowly, and just come to center, and then bring one knee towards the chest if you can grab. So you can do this and then opposite leg is stays there, or slowly try to lengthen out. So that way you feel your back is flat, okay? So this is called Pawan Muktasana, which is the air relieving pose. It's really helpful for your back. And push the other heel out when you're doing that. Just breathe and feel that your body. Relax your shoulder. Try not to go up like this. Shoulder down. Relax your back. Relax. Breathe and breathe. Then slowly go other one. Bring the other one in and you go out and just relax. Same way, you do this several times. When you're doing that, try not to bring towards the chest, but try to press down towards the spine, and his spine is flat. So this is really good and it will help you. You can always ankle movement, just doing that. Sometimes your knee, you can gently move if you feel like. You don't have to. And then slowly bring other one and then circle. Very, very. The minimum movement is always good if you're having the pain. Okay? And both direction. So sometimes people jerk close too fast doing that. That is not good for your back. You always just do very gentle. And then you can do the windshield wiper if you want. Again, try not to go too far. Just doing slowly. And then I'm going to show you the leg on the wall or on the chair. So that is very much relaxing. Same thing like when you're doing that, your back flat and lifting the leg is flat too. So I'm going to show you step by step, okay? So first, we're gonna get up slowly and you go all the way to the wall, sit on the side. So please don't make mistake, otherwise back hurts more, okay? Go all the way, and if you want blanket, bring there, that's fine. And then you push the hip right there and drop again, same side, like whichever side you drop, okay? And when you are right here, push your hip again towards the wall. Touch the hip on the wall and lie down. So now your hip is touching the wall, then keeping your abdomen engaged and slowly come up and then leg up. So if your hip is not touching to the wall, again go back and push your hip all the way and touching to the wall and come up. Otherwise your hip is out like this and then it's gonna hurt your knee. So always just go all the way, touch the wall and then slowly come up, okay? Once you come up, just relax there. Your arm can be up and down wherever you feel, okay, or here, or feel that your back flat. You stay there like 5 to 10 minutes. Some of you may stay longer. Please don't do that. Sometimes if your pain is so much and you just stay there longer, maybe it's just like frozen. The pain feel like later on it comes more. So try not to do that. Just stay as long as you feel comfortable. And you can point and flex your toes always. Staying there, or bring your hand, and you can roll your head side to side. And if you want to use your hand moving up and down, that's up to you. Always just do movement and just sitting there, or just relax, do nothing. And then sometimes you can do legs slowly, open one side and come back, open other side. Please don't go all the way down, okay? So if you are just practicing, going all the way, it pull more muscle from the other side. So always just do very slow and you feel flexible slowly, your progress happen, and then you can bring back without lifting opposite side of your hip. So opposite side of hip has to be flat on the floor. And so that slowly progress. Again, please not to go all the way down at the first moment. After a few days or maybe a few weeks you practice, you can just do that. And then bringing your soul together, you can just stay here or slowly drop and open and gently press. When you're pressing towards or closer to your thigh and then pushing out, it's really feel your spine is lengthening. But keep your spine all the way on the floor. Now coming up from here, so always bend the knee, and same way we're gonna roll our body one side slowly. When you roll, please do not come immediately up. Okay, we went there a little bit, just stay, let the blood flow, and then slowly come up. So that is on the wall. So I'm going to show you on the chair. Same thing if your wall is maybe too busy. And then you want to do on the chair. I have a chair here. And then bring the chair as close as you can and just do the same thing. I will put the chair this way because sometimes you have long leg, it has to follow that way. And then otherwise this way is okay for my short leg, okay? And I go there again closer to the chair like this, closer to the chair, and then lie down on the side, and then slowly lift my leg up and put on the chair. So when you're in chair, and you can bring the closer or have somebody support you, okay? When your back hurting, if you're doing that, it's really bad, but have somebody support you. And always have to be your like perpendicular, okay? Right here, if you remember. So your hip is right under your knee, okay? And then you just stay, or you can lift up and down. So all the movement, you can always do that. And putting your hand out just completely. And then so coming up again, slowly, really take your time. Always take your time. And then we are going to go to relaxation pose. So when you're relaxing, not to worry about putting lots of props, okay? So use as many props as you can, because you need support for your knee, you support for your back, you need support for your shoulder, so you can just do that. So put the pillow not too high, okay? And then if you want to put the blanket or something on your back, just completely just do that. And I have the big bolster here that goes under your knee. And then if your arm is like not resting on the floor, you can put your arm on your block or some pillow or something, okay? Same thing, we're gonna go lie down here, okay? So when you lie down here and bring your leg over, and just not to do like this, rest and relax, okay? So now your back feel comfortable, that's okay. And then your arm stays on the block if you want to do that. If your arm is not dropping, sometimes your shoulder is hurting, you can always put over the block, okay? So like this, rest there. And then so otherwise, however you want to do it, just completely relax. This is the best way for the back pain people, okay? And then if you sleep like this is good, but maybe like long time, sometimes it hurts, you do a little bit higher pillow. Or you can always roll and put the pillow between your knee. And when you're lying down, resting there, you can always put your hand slowly up above your head. Because if you do fast, you see like all your back muscle pull, okay? So always keep your muscle down, okay? Bracing your spine, your belly button towards the ground. Push that and slowly inhaling, lift up and drop. You can just do that. Take a long inhale, again bring up, exhale. You do very slow, and then completely lie down and rest. So resting is very important, not to put so much, not push your body, resting is important. It's how you work out your body. And also when you're doing the sideways, you can roll to the sideways and you put the pillow between your knee. But this is a little bit high right now, but you can just do that. So your back is instead flat there, so you're not pulling to the front, and you can always rest that way, okay? And then coming up again slowly, take your time, rest there several times, and come up slowly, slowly, slowly. And then you can relax, take your time always. I hope this helped you a little bit. If it doesn't help, please write comment and just let me know how you're doing, how is your back. And I also have other videos, so I will be putting short videos to help out, but I need your help to write down what you like to do it. Okay, thank you so much. Have a wonderful, wonderful time. Namaste.